leave. And this is an exciting day because we are officially kicking off the Roadmap to Health with Dr. Thomas Levy. And I need for all of you to share this information, share this link, text the link, call people, let them know that the classroom is open for all of us to open our minds as well, to learn new and different ways to take our health back, basically. And so I'm going to go ahead and start our class. We don't have a lot of time after the class for the teacher's pet corner. So start asking your questions, type in your queue with your questions. And if we can get to them beforehand, we will get to them. So let me go ahead and get started with the recording. Today is your lucky day if this is the first time that you have tuned into the classroom, because we have one of my favorites, Dr. Thomas Levy. We're not only going to be talking about what you don't know can kill you, but what you can do to fix it and to know better and do better. So fasten your seatbelt. It's time to get in the moment, and it's time to learn and grow together. Here we go. Time to bop your head, Dr. Levy.
The Lillian McDermott Show.
We love, we fear, bridges we burn, we make mistakes, then we live and learn. When life gets tough, and it seems like your best ain't good enough. If you're in need of hope, you know where I'll be right here. Right here, and when you need a friend, you can count on me. I'll be right here, waiting for you.
This is the place you can always turn to when you need a friend. The Lillian McDermott Show. To reach out to Lillian, visit her on the web at whenyouneedafriend.com. Now let's all learn together. Here's Lillian McDermott.
Hello, my listening and viewing friend. It's so nice we can meet each other on the air on this beautiful, best day ever. And for those of you who are tuning into the classroom for the first time, please know I've been waiting for you. This is a safe place where you can go to when you need a friend. It is my commitment to provide alternative ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, today is an exciting day because we get to officially kick off the Roadmap to Health today with Dr. Thomas Levy. For those of you who haven't heard about it yet, we have an early registration pricing that's not going to last very long. So listen up, because if you're tired of feeling sick and tired, and if you're tired of being told that there is no hope for you, or that this is the only way if you take this one little pill, if you are sick and tired of that there are other ways to open your mind, to look at different ways that you can do things that will promote healing in your body, that may not cost as much as it does to take that one or go into that white coat trance, as I call it, the white coat trance where you hear and obey. So today we're going to learn about the Roadmap to Health and what the things that we don't know that maybe have been told to us put in specifically to tell us so that we can consume more of these products to pretend like we're going to get better. And so today we're going to talk about what you, my viewing friend, listening friend, may not know that can kill you with board certified cardiologist, MD-JD, Dr. Thomas Levy, who I've said over and over again, all the information he knows cannot exist only on his head. And especially with those of you who don't like to read too much and you want to learn because you are auditory learners and all of that, listen up, because we have got an extra deal special for you. So since it is our sole purpose in life to give and receive love and knowledge, I am so grateful that Dr. Thomas Levy, MD-JD, is here to do just that. Welcome, Dr. Levy, to the classroom.
Hi, Lily. Always good to be here.
It's always thrilling because I know that everybody's already typing in their cues and writing their questions. You have really revolutionized the way we look at health and wellness with hydrogen peroxide, vitamin C, and oral health. And so here we are going to be talking about what we don't know that can kill us. And so what are some of the offenders that we do need to know, and that specifically you're going to be targeting in our workshop on February 6th, 2022?
Well, first, there'll be a segment so that people understand exactly why they have disease. And actually, it's amazing because what causes disease is very, very simple, but what resolves disease is not so simple.
Mhm.
But what causes disease is too much oxidation in different cells, in different tissues. Oxidation means just like iron that gets exposed to water and rust, that's oxidation. The iron loses electrons and deteriorates. Well, inside your cell, they have agents that oxidize, that take electrons away from your biomolecules. They're toxins, they're pro-oxidants, and that's how they cause you damage. They oxidize biomolecules.
Oh, okay. I think we lost him, or then you'd lose me. Robert, you may need to pull the plug, the other one. So it's Dr. Levy. So hopefully he'll be calling back. Or is it me, Robert? Am I live? Can you guys see me? At least for those of you who are watching, can you see me? I just want to make sure. Okay, Dr. Levy, you're back. You're back, Dr. Levy.
Okay.
Okay, so let's continue with oxidation. Sorry about that.
So basically, you don't have disease until you have an excess of biomolecules that have been oxidized, okay? And in a specific arrangement, this type of biomolecule, this location, that's what disease is different locations of biomolecules oxidized. The important point there being is you have two ways then of dealing with disease. And one is to try to identify and stop the new toxins that are coming in that are continuing to oxidize new biomolecules. You want to stop that. And at the same time, you want to bolster and maximize the molecules that repair those oxidized biomolecules, which are antioxidants, which the premier antioxidant is being vitamin C. So with that in mind, we will concentrate on the most common sources of toxins in the body, which pretty much come from the mouth, come from chronic infections in the gums and the teeth and the tonsils, you name it. I'll show everybody that this is not just speculation, but very clear cut. I'll also show everybody that, and my background is as a cardiologist, that virtually 100% of coronary atherosclerosis, the plaques that build up on the coronary arteries and cause heart attacks, virtually 100% come from infections in the mouth, because
Wow.
they've actually scraped out the plaque in different coronary disease patients. And in the one series that I cite, they did it in 36 out of 36 patients, and they all had enormous amounts of oral pathogens literally growing inside the coronary artery and the plaque. And what does that do? That consumes all the vitamin C, that causes inflammation, and you have your heart disease. And why is that? Why is this tragic? It's tragic because still virtually no cardiologists, virtually no internists, virtually no general practitioners are even looking at the mouth, much less doing what I recommend be a baseline test, right along with your glucose, right along with your biochem panel. If you as an adult come in and you have a newly diagnosed disease, your therapy shouldn't extend at all until you've had your mouth examined with a 3D cone beam examination, because most infected teeth, well over 95% of abscessed infected teeth do not hurt. So a lot of people want to be able to solve things with a pill, but I got to say, maybe so. The good news is there are answers that can restore your health and have you live a long, healthy life. But the bad news is it can involve stuff that you don't want to do. Nobody likes to go to the dentist. Nobody likes to get what needs to be done there. But that, along with many other factors that contribute to that, are among the things that we'll be discussing.
It's really interesting that as a cardiologist, you would reach the conclusion that when people have infections in the mouth, whether they know they have an infection or not, that they can lead to heart disease 100% of the time. Did I hear that correctly?
That's right. I mean, to my knowledge, they've never identified an atherosclerotic plaque that doesn't have oral pathogens growing inside it. Now, maybe if you look at 5,000 plaques, maybe you'll find 2 or 3, but for all intents and purposes, nobody should count on being in the 1/10% category that might not have that. Okay, so things
Rule it
occur
out.
for things
Rule it
occur
out.
for a reason. Actually, cardiology now, amazingly enough, acknowledges in their literature that atherosclerosis is an inflammatory disease. But they don't want to peel another layer of the onion off and ask the simple question, well, why do we have an epidemic of inflammation in the coronary arteries? We have it because they're chronically seeded with pathogens that metabolize, produce toxins and pro-oxidants, use up all the vitamin C inside the artery. And once you use up all the vitamin C inside an important structure like the artery becomes weak, and the body's own compensation, because it can no longer make the connective tissue that's needed with amounts of vitamin C to make it strong, the only thing that's left is for the body to try to make the blood vessel thicker. And it's a poor compensation, but it's the only compensation the body has. So basically, you're dying of a compensatory response of your body to virtually zero presence of vitamin C inside your inflamed, infected blood vessel.
Okay, so I know that many of us, we're so concerned about our smile, our teeth, and all of that. And there's a lot of people that can't afford to go to a dentist, can't afford to go to a dentist, or maybe they weren't taught that oral health was just as important as overall health, or brushing your teeth, or flossing, or whatever, that is really, truly important. How do you get someone to look at their mouth and see, like, just open their mouth and look, okay, how many cavities do you have? How many root canals do you have? How much gingivitis do you have? Is that what you look at when you're looking at the mouth? How do you determine?
But on examination,
issue?
it's just by looking at the mouth, and you immediately see what kind of shape the gums are in. Okay, whether they're nice and pink and rise up between the teeth, or if they just not as pink and they sort of flatline below the teeth rather than grow between the teeth. This is a direct indication of how things are going on in the rest of your mouth.
Yeah.
But the thing that people also have to realize is, I will offer other options beyond getting an abscess tooth extracted. Now, obviously, it should be obvious that if you have something in your body that's abscessed, it needs to come out. That's the best thing for your health. But you have somebody that doesn't have enough money, doesn't have the inclination, has dentistophobia, whatever you say, there are still things you can do, not as good as getting rid of the abscess, but things where you finally adjust thyroid function, you finally adjust sex hormone function. All of those things substantially modulate how bad an infection is for you in your body. And there's an expression I say, when you perfectly adjust thyroid function and sex hormone function for many people, you can keep focal infections focal. Okay, so there are 10 less to disseminate. Again, that's not my recommended number way to go, but if you're going to rule out any possibility for personal preference or finances or whatever your reason is, there are other things that can be done that can statistically help you out a great deal. But when somebody says, but what's the best thing for me? Well, the best thing for you is when you have an infection, you get rid of it.
You get rid of it. Now, okay, because you and I have had several conversations, many conversations here, and I've had so many other doctors, getting rid of something doesn't solve the problem if you're not changing your lifestyle. Is that more or less what you're going to be discussing in the workshop as well? How are some of the things that you can change your lifestyle? So these things, just pulling it out or taking the tooth out, and you continue eating the certain way, or, you know.
Sure, absolutely. And I mean, it's perfectly appropriate way to look at it is, first of all, let's stop the speeding train going down the track, and let's get the infection out, and then we can start to, if you will, build new track that the train can proceed on and allow you to have a healthy lifestyle. Basically, the problem that so many people have, and that many nutritionists and other physicians have, this, that, and the other, is I won't say they overemphasize, I'll say they give too much credit to proper diet and everything else turning your life around.
Correct.
You can make a big deal of difference. You can help a great deal, but if you don't, as my mentor said, Dr. Huggins, if you don't turn off the shower, if you try to dry off while the shower is still on, you're not going to get the effect that you want. You'll get an improvement. I'm not discouraging in any way quality supplementation or quality diet, not at all. But I'm saying those will be the aspect of the program where, well, now we've done the major intervention, we got rid of the infections. Now what do we do to improve lifestyle and maintain and even improve health now that we no longer have the shower pouring on new toxins into the body on a 24/7 basis?
Correct. Okay, so these are some of the things, this is what we're talking about today. You know, there are things that we don't know that are killing us, and we're taught they're good for us, and that we should, you know, like milk does the body good. That's not true. You know, calcium, magnesium, you know, and how do we use all these things in our body? So I just wanted to share it with you. On February 6, 2022, Dr. Levy is taking us into this journey for our unique health, because one size does not fit all, because what's causing my condition may be different than what's causing your condition, right? And so the roadmap to health, you get to learn about yourself, get to learn about all the things that Dr. Levy has been sharing, writing about, and now you have an opportunity to attend this workshop, and not only attend, but ask questions for Dr. Levy. Now, fortunately, Dr. Levy is a very generous man, and the workshop, it costs $350, but because we're doing an early registration for $299 if you register, and we changed the early registration date because today is the official date, and it's going to change to December 30th. So by December 30th, you will get not only the early registration pricing, Dr. Levy is very generous. He's also sharing 5 books with you: Rapid Virus Recovery, Primal Panacea, Death by Calcium, Magnesium Reversing Disease, and Hidden Epidemics. You will also get those 5 books for you. You can download them once you register into this workshop. And it's a virtual workshop. So if everybody's packing their bags right now, you don't have to pack your bags. We're doing this for all of you so that you can empower yourself come the new year, because a lot of people are going, it's the holidays, I don't even want to work on that. But come the new year, you can start living your life the way that will be optimal for your life. Can you say something, Dr. Levy, about what's optimal for you? Me may not be what's optimal for you. How do you determine what's optimal?
Well, due to genetic variations,
Okay.
due to different lifestyles, due to ethnic changes, different populations being more susceptible to one thing and another, it's true that the same precise protocol is not optimal for everybody. Mm-hmm. And this is why, in conjunction with everything that we'll talk about, people absolutely have to find a good integrative physician that they're comfortable with, that can look at their blood work, look at their lab tests. Some people will have a glucose problem, others will have a cholesterol problem, others will have a thyroid problem. So the degree to which you approach all of that is not going to be the same for everybody. There will be certain basic things that everybody should do, but you need, of course, the input of that good physician to help you out in doing the ultimate fine tuning on what's best for you.
Correct. And so
I want to add too that just so nobody's confused. I mean, we'll be gifting the electronic version of the book, so I don't want anybody confused to think that we're going to give them 5 physical books in the mail.
No.
Right.
No, it would look like my house. I mean, my house is so full of books. I was like, I'm lining walls with books now. But no, these are electronic books that you can read at any time. You can upload them onto your phone, your Kindle, whatever, wherever you want. I know I have many of Dr. Levy's books, and they're so helpful. So what you listen into the workshop, you can also maybe mark it in the book as well. Dr. Levy, one of the things that you've said, and I've said as well, many, many years ago, nobody's chemotherapy deficient. This is what I used to say a long time ago, but you're saying that we don't have prescription drug deficiencies. Can you share a little bit about that?
It's kind of funny, but it's not completely untrue that many doctors and much of the public really think that when they have X, Y, or Z disease, they have a prescription drug deficiency because it makes them feel better and this, that, or the other. The problem is prescription drugs do not naturally occur in the body, and there are no deficiencies of something like that. It seems almost silly to point it out, but it does need to be pointed out. Whereas virtually all diseases, if not being caused by, are severely aggravated by, yes, deficiencies of vitamin D, deficiencies of vitamin C, deficiencies of magnesium, deficiencies of iodine, deficiencies of vitamin K, of the B vitamins. All of these things, because of modern food processing and the way most people eat, they're not remotely getting enough of these substances in their body to maintain good health, much less bring them back to a state of good health once they've descended into bad health. This is what orthomolecular medicine is all about. That's the term that Dr. Linus Pauling coined. Ortho means correct, molecular means molecule. So in this case, Dr. Pauling was making the point that the ultimate way to treat disease is to identify the vital natural substances that you don't have enough of or that you have a deficiency, and make sure they're repleted and restored as completely as possible. Now, I don't want people to think that I'm just across the board anti-prescription drug, not at all. But there are a large number of prescription drugs that are not necessary and are highly toxic. But perhaps my particular pet peeve is high blood pressure. Okay, I've treated a lot of high blood pressure in my day. And sometimes you're going to do everything that I advise and clean out your mouth, and your blood pressure is still going to be elevated. Maybe not as elevated as before, but still somewhat elevated. Don't think that you're just going to treat that with vitamin C and vitamin D and everything else. You do need to take a prescription drug as long as the blood pressure is elevated at all, because that independently can cause increased chance of heart attack, stroke, and all the other things that could bring around the end of your life. But I'm not talking, on the other hand, about just reflexly treating all pain syndromes, arthritis, this, that, or the other with all the prescription drugs, because you will find that there are combinations of natural agents that can cool that inflammation down very significantly. But I'm not completely across the board saying ignore your doctor and don't take a prescription drug. And don't rely on one normal blood pressure measurement. If you think you brought your blood pressure down to normal, you need to get together with your integrative physician and get what's called a 24-hour monitor of your blood pressure to see if you're spiking too high or if you're truly in the control range most of the day. So Not much prescription drugs, absolutely, but there is a place for them, although I consider it to be an extremely limited place.
Okay, so you're saying when I hear you talk about high blood pressure, because we also know, is a high blood pressure a statin medication? Is it considered a
That's the
statin?
cholesterol. That's the
Oh,
cholesterol.
cholesterol. Okay. Because I know that cholesterol can cause the medication for cholesterol. There's class action lawsuits that cause dementia-like symptoms. So I was talking to somebody, a friend just recently, and he was saying that he was on high blood pressure medication and he retired because he was getting forgetful and he didn't want to be made fun of at work, but now he's fine, but he's not taking the blood pressure medication. I asked him if his memory got better and he says, well, I don't know, but he was just being funny. He said, yes, he has gotten better. So there have been many cases for people that are taking cholesterol medication. What do you recommend for people that are, these things that their body is telling them something's wrong? We go to the doctor and the doctor gives a pill instead of saying, that's a symptom and their body is telling you that you need to do this or that. I mean, how do you tell people to just stop and listen to their body and give the body what it needs?
Well, probably a good example is the cholesterol. And that is, it's sad how cardiology and medicine has just turned cholesterol into the ultimate demon and now try to medicate cholesterol down to ridiculously low levels. What are ridiculously low levels? 150, 140, 130, 110, and even lower. And this was established a long time ago, is in my book, Optimal Nutrition for Optimal Health, which is there's a whole host of studies that show that when you do nothing else but arbitrarily with a medication bring an elevated cholesterol way down, your chance of cancer goes way up. This is because cholesterol is a natural, in addition to many other functions, not the only function, cholesterol is a natural antitoxin. And in most people, when it elevates because you have an elevated level of toxicity in your blood and your body is making more cholesterol to counteract it. So what happens when you do nothing else except take away the body's natural protection against that toxin that's not going away, is then you increase the toxicity everywhere, which translates not only into general disease as well, but specifically an increased incidence of cancer. And as we discussed earlier, just like the heart disease, this is virtually always due to the seeding of toxins coming from the mouth. So for most people, nothing's 100%, but for most people, you get rid of those toxin sources and the cholesterol comes down into a nice normal range. But the problem is, what's the real normal range is something that the cardiologists and internists feel is still too high. I mean, if you have a cholesterol of 190, 200, that's perfect. But so many people with 190 to 200 come in and they're going to statin them down to a 110 and really do them far more harm than good. Now, let me add, the only time that I consider a statin to be indicated, and it's extremely minuscule, is when you come in with astronomical cholesterol levels, 350, 400 or more, something along those lines. And you do all these interventions that I talk about, and maybe it drops a little bit, or you don't want to do all the interventions, then above a certain astronomical level, cholesterol can rapidly accelerate, not cause, but rapidly accelerate the evolution of atherosclerosis that's already present. So it's my opinion, not like there's a big study, it's my opinion that bringing a 350 cholesterol down to 280, 270, 260 is a benefit in decreasing your chances of a heart attack without unduly increasing your chance of cancer and the other things that those unneutralized toxins present. But once again, just like we talked about earlier, first and foremost, if you can identify an infection or source of toxins, eliminate it, take it out, neutralize it, rather than just go straight to a pill that you think is going to neutralize it, because no pill does that job completely.
It's even the idea of the pill. It's like, okay, this pill is going to work with me and that's going to work with you. And our sizes are different, our situations are different, but everybody's getting the same. And he's like, okay, how is it going to affect you? How is it going to affect me? Nobody ever even talks about that. So, Dr. Levy, I have to tell you, when I started eating raw vegan and started eating whole food plant-based, and I was doing it was a radio show at the time, and I had all my blood work done by this company that was figuring out if you had the ApoE gene, which is leads to dementia, right? It's now coming from my brain. I'm just going, and it also measured my cholesterol, and it was 300. When I saw it, I almost like, what? My cholesterol, it used to be like 150, 180, 150, 180. That's what my cholesterol used to be. It was 300. And the doctor said, I have never seen cholesterol as good as this. Don't look at the 300 because the LDL and the LDL and what is the LDL? HDL and LDL, the ratio was perfect. And so are there, when you see somebody that's 300, like me, do you look at the ratios as well? Or was that bad for me to have 300?
Well, I look at the ratio for some positive assurance, but a cholesterol that high, I still vigorously look at the mouth, gums, root canals. 100% of root canals are infected, as we've discussed. And just don't think because you had the root canal and whatever pain you had away at the time, they're all infected and they all seed the body. So no, I still evaluate the mouth on something like that. But it is much better, obviously, to have this positive good ratio when your cholesterol is in the what you would otherwise consider to be elevated range. But no, it's I actually have a friend right now, something very similar, not 300, but has a good ratio. And I said, well, she's in her 40s. I said, well, we can't go on with blinders like this. And she's going to see my dentist and get a 3D cone beam examination. And here's another point too, something we'll make very clear during the presentation time is whenever you've had a root canal, and in her case, she had a root canal in the past.
I have a root canal.
Okay. She got it removed and now has an implant. Well, if her gums are perfect and there's no infected teeth and the implant is doing fine, guess what? She needs her tonsils injected with ozone because it was draining a root canal for years and the tonsils do not clear themselves up all by themselves. So even if she doesn't have anything there, which is important to know, she still needs to see my dentist and get the proper injections of the ozone, which is unfortunately, although a very easy thing to do, you need two things. You need a dentist that has the ozone set up and you need a dentist willing to do it. Not that it's complicated, and it's very easy for your ozone practicing dentist. And ozone has many, many applications in dentistry to help sterilize infection sites after you pulled out an infected tooth and make sure everything's cleaning, and along with platelet-rich plasma and platelet-rich fibrin and all those good things. So, but that's something that needs to be done on a really a routine basis for most adult dental patients. It adds about 4 or 5 minutes to the visit. And I mean, I don't know, it's up to the dentist what they do or don't want to charge for it, but it's usually if you've had some extensive dental work, most dentists that I know of will add it on at no charge, but I can't speak for all dentists in that regard. But it's very important that the tonsils get injected almost routinely at dental visits, unless you have a perfectly healthy mouth infection wise, perfectly healthy history of no infection. Because like I said, the tonsils don't seem to recover on their own. Once you seed them with pathogens from an infected tooth over a few months or a few years, and those teeth come out, the tonsils can not only not clear themselves up, they will then seed pathogens in the body just like the teeth did when they were infected.
Wow. Okay. So Many years ago, Dr. Lee Cowden said, even if you had your tonsils removed, you still have tonsils.
Well,
Can
yeah,
you?
there's actually in the mouth, just as your mouth and the back of your throat is circular, you actually have a circle of tonsillar tissue. It's called Wall-Dyer's ring. At the top of it, at the back of your throat, is the adenoids. Then you have lateral scattered tonsillar tissue. Then you come down to the large palatine tonsils that most people are aware of. And then you have at the back of the tongue something called the lingual tonsil. So yes, you could have tonsillar tissue that's still holding on to a lot of infection, even when you've had your tonsils taken out. So it's not an absolute guarantee to leave that way. Yes.
Yes. Okay. So because we don't have a lot of time after, I'm going to start reading some questions. Dr. Levy, do you mind?
No, give me 15
Okay. While
seconds.
you're doing that, I'll talk about the classroom, and I'll also talk about the workshop. Okay.
Okay.
Okay, so come on, don't remember to come back. Okay, so for those of you that are listening to Dr. Levy today, and maybe this is the first time and you're probably on the floor going, how could I have not been told this? Or this stuff is like woo-woo. No, look it up. Look it up. He is not the first one to say these things, but he's been able to put everything together as a cardiologist, as a board certified cardiologist. And the fact that he's done a lot of this research, we can benefit from this. And so I just want to encourage all of you, because not only will you be able to register to attend this workshop, you're going to get 5 different ebooks that will also explain all the details. Like, you don't have to be an educated practitioner to attend this workshop. I'm going to attend the workshop. All lay people can attend the workshop, and you'll be able to practice this on yourself. Be your own MD, your own medical detective, as long, and we know really good functional doctors, Dr. Jennifer Gramuth, who's a sponsor of the classroom. And I just want to encourage you to go to whenyouneedafriend.com, check out the information, check out all the resources that you have at whenyouneedafriend.com. While you're there, please subscribe so that you know who's in the classroom. You can scroll down to where Dr. Levy's information is. You can click on his name. It'll take you to peakenergy.com. It'll also take you to the workshop so that you know what's going on in the classroom. Please support our sponsors the way that they're supporting the classroom. Like and follow me on all social media as well. Also, go to the Shop Now bag and check out the workshops that we have. We have the DVDs just in time for the holidays. We have so many things that whenever you click onto whenyouneedafriend.com, it helps out the classroom grow. And also, you can become an enrolled student in the classroom, and whether you can donate $1 or $1,000 a month, anything, your time, your talent, your treasure will help grow this information and be able, because the more they're censoring us, the more expensive it is to have a broadcast. So please know that whatever you can do, whether even if it's to share this video with somebody else that you know would love to attend the workshop. So there's so many workshops coming up. February 6th is the one with Dr. Thomas Levy, the 5 books that you will get when you register, and you'll get them as soon as you register. Give us 24 to 48 hours after you register, because we don't have an automated system. So we need to make sure somebody's in the office. You will get rapid virus recovery, primal panacea, death by calcium, magnesium reversing disease, and hidden epidemic, we just did a class on that, and it's about the mouth as well. So there's so many things. And so for early registration, which is before December 30th, and you can go right now, December 30th, you will pay $299 as opposed to $350, which is the actual cost of the workshop. And let me tell you, I think $350 is very generous. We're going to spend, and he's even more generous to lower it down to $299, plus give you 5 extra books. So please do it now. Don't even think about it. Just do it. If you want to take back your health, just do it. and attend the workshop. I don't know if we're going to be recording. We probably will be recording the workshop. So if you can't attend that day, you can still buy your seat and we will send you the video. So let's figure out as we get a little bit more organized how we're going to handle the video with Dr. Thomas Levy, so that you can start taking your health back. Again, you can go to Dr. Thomas Levy's website as well, and it's peakenergy.com. And so, Dr. Levy, I am just so grateful anytime you come into the classroom, because you always say something that makes me just go, that makes so much sense. You know, we've been lied to. We've been lied to. And that is what we defend. We defend our ego. We defend the lie. But if we just say, I want to be curious about my health, as opposed to critical about what Dr. Thomas Levy is saying, or what Dr. Day is saying, or what other doctors are saying that come into the classroom that are integrative, functional, holistic, be curious instead of critical, because you might find that it's the life-changing workshop that's going to change, that's going to make a big difference. Now, Dr. Levy, thank you so much for taking the time to do this on February 6th. I know that you're already preparing, because there's so much information that you have that we need to have more time to dive deeper and do this ourselves. So thank you so much for that.
My pleasure. I hope a lot of
Yes.
people can attend, because actually, I don't know how many are going to actually come, but I been getting requests like this for years in my email, where can I go to learn this? And I have nowhere to send them. So I said, well, it's high time I just put everything together, and depending on the response to this will determine whether I do it one time and never again, or if there's a lot of interest, we'll start doing it on a more regular basis. If 10 people show up, it'll be a one and done. If a couple hundred show up, well, we'll start doing it on a more regular schedule.
Yeah. And you know what, Dr. Levy, I would love to have like continuing education credits and things like that, where people can actually come into your classroom, into the classroom, and have that extended education and maybe a certification from Dr. Thomas Levy that will help, so that you can not only just help yourself, but if you are a practitioner, be able to help other people as well. Dr. Levy, there's a question, there's several questions, so I want to address the questions. I know that we have other things that we want to talk about today, but the question is, 3 years ago, had a 3D scan and no infection, had another one done yesterday, and infection was found in a wisdom root tooth. I do oil pulling and use food grade peroxide in my water pick. Can infection lay dormant?
It can lay dormant in the sense that it doesn't hurt, but that doesn't mean it's dormant with regard to not being toxic. Something that I've started to emphasize to try to help people understand a little bit better is infection anywhere in your body is bad. Obviously, an infected gallbladder or infected area of your intestines, prostate for men, ovaries for ladies, et cetera, et cetera, et cetera. But for the most part, they're never going to have the impact on you of an infected tooth. Why? Because you don't chew on your ovaries. You don't chew on your prostate. When you chew on a tooth,
good visual.
Yes, I guess. When you chew on a tooth, especially the big ones in the back, like this lady's talking about, that's the pressures generated are enormous between the opposing teeth. And you're already hooked up to the lymphatic system, to the venous system, and you disseminate infection better than if you had an IV and a needle. Okay, so that's what makes infections in the mouth and in the teeth in particular, I don't even know how I can put a number on it, doubly, triply, quadruply more significant for how it's going to impact your health than if you have a local area of infection somewhere else in the body. So I always say, you can have infections anywhere in your body and you always want to resolve them, but it's going to be the teeth that bring you down. And you can't, or you shouldn't, ignore it because it doesn't hurt. because that's the characteristic of greater than 95% of chronically abscessed teeth, is they feel fine.
So can something happen from 3 years ago to today that may cause, like maybe 3 years ago they didn't have an infection, but now this is an infection for it's a wisdom tooth root. Can something put you over the edge? And maybe it was always kind of like getting there, but it put it over the edge where it was noticeable?
Absolutely. And one of the things that I've said multiple times in my presentations, and this is why I think this should be a baseline test, is for exactly that reason. I think if you're a 21-year-old kid getting your physical to play football, whatever blood work they do, glucose, make sure you don't have diabetes, make sure you don't have high blood pressure, make sure you don't have heart murmurs, you should have this test done as well.
Yeah.
And
I was just corrected. It's a 3D. It wasn't 3 years. It was 1 year ago. So they must have repeated the 3D. So it was 1 year.
Well, absolutely.
So,
I mean, things can occur in a week. Things can occur in a month. They can certainly occur in a year, especially if you unknowingly traumatize the tooth, bite on something hard, cause it to split, opens up access to the pulp. Once it becomes infected, you will get an abscess. But what I was saying, you have the 21-year-old kid, he has a normal one, that's fine. And should he be unfortunate enough to see his doctor when he's 35 years old and find that his blood sugar is now elevated, well, that's the time you need to repeat the test and see whether you have the toxicity of a newly abscessed tooth provoking the onset of a new diabetes. So it should be a test to determine baseline, and if you're fortunate enough to be normal in that regard. And other things too that we can talk about at the time of the presentation is that these tests can be sent off for more refined interpretation. Okay. There's a lot of dentists out there. I can't tell you what percentage or how many. They have these machines and they use it for areas that they're interested in, but they're not really interpreting them thoroughly. I say that because this test has so much information in it that it really requires an advanced interpreter a full 30 minutes to interpret. And we know dentists are busy. They don't have 30 minutes to look at a variation on an x-ray. They're going to go straight at the teeth. They look, see what's going on there. Point being is, there's a lot of stuff that can be missed too. So it's worth the time and investment. There are different areas, different places these tests can be sent where they can be interpreted by people that do a high volume of interpretation. And they send you back a very refined examination with focal imagings of the areas that are most intense and that are most evident. And there's a lot of stuff on there that doesn't involve infection too. I mean, that's what we're talking about here is infection, but well, do I have any cavitations on the jawbone? Are the tonsils showing any areas of radiolucency or necrosis or this sort of thing? Could there be, because there's a lot of information, some area that doesn't look right that might represent a cancer or some other benign growth? So there's a lot of information in these tests, and it's worthwhile. Whatever, probably a couple $100 to get a more advanced interpretation as well.
Yeah. And I'd like to also add, you always recommend going to a biological dentist or biologic dentist. Is it biologic or biological?
Biological
Dentist. Yes. So please look for that as well. And if you are in Florida, Dr. Levy has a wonderful, if you're in South Florida, I also have a wonderful doctor, biological dentist in Brevard, Central Florida. And I'm sure that there's more. There's a lot of dentists are going out there and expanding their certifications and degrees because they're realizing that they can be more impactful than they have. I mean, I know that Dr. Huggins was very impactful in your life. And because of it, you probably were able to save more people from having a heart attack or be cardiac risk, whatever it is. So It's
Well, I
wonderful.
certainly think I was a multiplicative factor in getting Dr. Huggins' word out. Yeah,
Yeah.
I made a contribution, I believe. Yes.
Yes, you have. You have. Okay, so we have another question. All statins contain fluorine, serious toxin, just as the Cipro class antibiotics do. I believe both are serious problems. So, what is the question? So, all statins. So, is there a particular thing that causes the statins to be serious? So, they're talking fluoride or fluorine.
I don't know that fluorine is the thing that makes a statin toxic. There's a lot of things in antibiotics from where they're derived, all that can have a residual toxicity. So I can't really tell you why this antibiotic is going to be toxic for this and another one's going to be toxic. So, but obviously anything that has additional agents in it independently established to be toxic, that's going to be one more negative. Absolutely.
That's right. That's right. So, Dr. Levy, we have about 5 minutes left, and I do want to encourage people to go click on the link and register as quickly as possible, because people put that aside and go, I'll do it tomorrow. Next thing you know, you'll be missing the early registration pricing, and you'll also be getting the 5 books as well. So let's talk about some of the other things that can kill us that we don't know about, that we can maybe talk for a little bit longer before we go.
Well, jumping out in the middle of the interstate could kill you. That's one.
Yeah, but we know that. That we know.
Being in an airplane that runs out of gas, that'll do it too.
Yes.
No, it's
Stuff that's less obvious, though.
I don't know that I have anything specific to say to that. We've talked about then you start getting into things about diet. You start getting into things about chronic pathogen colonization.
Emotional stuff.
I would say emotional stuff is a magnifying factor. I wouldn't call it unless you're suicidal, I wouldn't call it a primary reason for ending your life early, but definitely it makes any pre-existing pathological condition worse, no doubt about it. And we've talked about before in previous sessions when we're talking about rapid virus recovery. Well, in addition to what we talked about in being able to get rid of acute respiratory infections, it naturally evolved into the fact that many people are much sicker than they need to be because they're not taking simple measures to normalize gut function, normalize the microbiome, and seal up the leaky gut. And believe me, it's not that complicated, even though there's the hugest of cottage industries imaginable in tending to every gastrointestinal symptom imaginable, diarrhea, constipation, gas, bloating, burning. Look in your drugstore, you see aisles and aisles and aisles of over-the-counter preparations because it's something that so many people share. Vastly more people have chronic pathogen colonization in their nose and throat, keeping their gut in disarray, than have normal. And that's because, well, all the reasons are discussed in one of the books. We don't need to go into all the reasons except to say that most people have this. If they had a cold or they had the flu years ago, they still have it unless they took specific potent antiviral measures. I'm not talking about antibiotics. No antibiotic touches it. Specific antiviral and anti-pathogen measures to completely strip the biofilm and the pathogen colonization out of the nose and throat. And then many people, not all of them, can reach levels of health that they didn't imagine possible.
Mm-hmm. We've learned so much from you already, Dr. Levy, but there's so much more. I said it from the first day I met you. I know you've written a lot of books. I know you've done a lot of topics, and you've given a lot of speeches and taught a lot of doctors, but we have an opportunity here to take all of that and put it into one place where we can interact with you. Can you imagine being in a classroom setting where you can actually interact with Dr. Thomas Levy and be able to ask your questions privately? I'll read the questions and have that dialogue with Dr. Levy. To me, this is priceless. And I'm grateful that the pricing is so low. And not only that, we're sweetening the deal with a early registration, and Dr. Levy is so generous. He's giving you guys 5 ebooks once you register. I think that this is going to be an incredible opportunity for all of us to start thinking of ourselves as a medical detective for our own body. Our first line of defense would be for us to know more about our body. And Dr. Levy, thank you so much for empowering us and letting us know that we can pay attention to what our body needs so we can get back on our yellow brick road and that road back to health. So thank you so much, Dr. Levy, for everything that you're doing.
Well, thank you so much for helping me get all this information out there.
I am loving
that's
every
the whole
minute.
point. Yes.
I am loving every minute. Okay, we're going to spend a little bit of time. So if you have any more questions, go ahead and type in your Q's and let's get busy because we've got to finish off early. And please remember, we'll be right here waiting for you worldwide at whenyounneedafriend.com. This is Lillian McDermott and Dr. Thomas Levy wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Listen to this guy.
And are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.
Okay, so here we go. So we already have Karen says, I'm taking this class. She's already registered, so she's really excited about it. Now, when somebody hears something, Dr. Levy, and it resonates in them, they're willing to do this. But what's going to make them, in your opinion, and what your experience is, do you see that when people know the truth, these new truths about their body, these new truth cause, do you feel
the extent that, let's example, let's just say I'm talking to somebody who just can't say, and this is just a hypothetical, this is not the truth I'm saying, this is, and I just say, well, look, sugar in the amount that you're taking does this, and this accumulates, and here it is, and every time you eat sugar, you end up with more of this toxic substance in this part of your body. If you give somebody a clear explanation as to what they're doing and why they're doing it is demonstrably bad, not just, oh, that's not good for you, but demonstrably bad, or you even better, you have a blood test that's abnormal. And you show somebody when you do this and this blood test comes down, you know that you're doing something that's clearly good for your health. A lot of people, they're fine with just hearing their doctors say, well, do this, don't do that. But my impression is for most people, it's in one ear, not the other. But if you show them the fact that, look, let's do this, 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 and this, and then we're going to repeat the blood work in a month. And when you see what you did clearly brings certain blood tests into the normal range, then yeah, I think it has a lot more impact for a lot of people.
Very good. I just, I just want to share something. I normally don't share private conversations, and I may embarrass Dr. Levy, but, and I hope I don't embarrass you, Dr. Levy, but I want people to know that I have interviewed people that are prima donnas, like off the air, prima donnas off the air. And it's about them, and about them. With Dr. Levy, it's not like that. What you see is what you get. He wants this information out there, and he could charge a heck of a whole lot more for this class than he is. But I want you to acknowledge the fact that, Dr. Levy, you have pretty much been a maverick. You have, revolutionized the way that people look at cardiology, revolutionize the way that people look at gut health. You've made the connection with hydrogen peroxide, where there's a lot of other doctors, they have all this information, but you come from a different angle that makes so much more sense. And I think that is admirable. I admire you for that. And the fact that that you're not doing this to get rich. You're doing this because you really, truly want this
Too
information.
late for that.
That's true. That's
Yeah.
true. You could have been up about all the money all along and not even shared this information and just done bare minimum, because there's a lot of wealthy cardiologists out there.
True.
And
I'm not one of them.
no. And so when you talk about being a maverick, I'm sure, I mean, it took 20 years for doctors to learn how to wash their hands. When one doctor said from Hungary said, when I wash my hands, the people that are giving birth don't die. And it took 20 years for that to come through. For you, have you felt like salmon going upstream with this information? Have you felt like people are finally catching on? People are finally listening? Or do you feel that they were listening all along?
The ones that want to listen. It's interesting about salmon upstream. I've virtually never, really and truly, in all the lectures and presentations I've given, I mean, 2 or 3 times tops, has anybody tried to contradict what they say or come down on what they say. And I take that as a message that by listening to me and seeing how I base everything clearly on logic and results and outcomes, and I'm not just pushing some personal fantasy, that those individuals know, not that I would be nasty, but that I would logically show them to be completely devoid of logic and basically make a jerk out of them for even wanting to just try to make some ridiculous point, not grounded in science, but just try to give me a hard time. People don't go after somebody that they know can calmly and rationally make an ass out of them.
And that's one thing I notice about you. You're very calm about the information that you send. There's no hyperactivity or, you're just really calm. You know this information, and, you and I don't even talk about it ahead of time. Like, you have no idea what I'm going to ask you for. Actually, I have no idea what I'm going to ask you because we have a conversation that people have the benefit of listening and eavesdropping into. That's what the whole classroom has been about since it started. You're eavesdropping in these conversations and hopefully learning and growing. But now it's been moved up to these classroom settings where now we can go and get advanced education, not just the 1 hour in the classroom, but now advanced education. Do you think, though, 6 hours is going to be enough to uncover everything that you know?
No. I'm going to present it in such a fashion that it'll be the most significant information. But gosh, I don't even know how many hours of information we could be put together depending on the subject. But this will cover the most important stuff. I'm going to try to make it as digestible and easily assimilatable package as possible. Okay, just what's the foundation of the disease, certain blood works, certain supplements, certain other interventions based on the physiology that we'll talk about. It'll pretty much cover all the significant bases. Well, it's like anything. I mean, you can look at the overview, and on any given area, you can go deeper and deeper and deeper and deeper into the weeds. Okay, so a physicist can give you an explanation of something, and you can ask a dozen more questions, and they can go deeper and deeper and deeper. So no, there's stuff that can be talked about for many, many, many hours. Everybody has their own problems that they want to discuss. Not that we're going to be doing consultations. I want to make that clear, so I'm not here to practice medicine over a virtual conference with you, but we will talk about the basic concepts and we'll give people the information, if not that they can use themselves directly or with an integrative physician that they can later on affiliate themselves with.
I love it. I love it. Well, Dr. Levy, I want to thank you again for everything that you do. I know that between vitamin C and hydrogen peroxide and and the things that you have taught me, it's been life-changing. I know that Robert is even nebulizing. I'm nebulizing. I know so many people now with their water picks and their dental health and looking in their mouths and considering having, I'm even considering having my root canal removed. And so so you're making us think that if we're sick and tired of being sick and tired, that we can actually do something for ourselves that is proactive, and attend the workshop on February 6th, 2022. We made sure, because of Dr. Levy, there are no football games going on that day. And so nobody's going to miss any football games. And then we're going to decide from that point on, do we need to add more? Because there's so much information, and I'm hoping that we'll be able to get all of it, because it is just so important to change our lives. So is there anything else before we go, Dr. Levy, that you would like to share that maybe we didn't get to share during the regular podcast?
No, other than to say you're absolutely right. We researched that well, and I'm not going to give a presentation if Alabama is playing Georgia, or if the New England Patriots are playing the Tampa Bay. I don't know if they're in the right conferences for that or not. So this is actually for the sports fans out there. When the Super Bowl is determined, the Super Bowl takes place 2 weeks later, and this is on the week in between.
Yes, and it is a Sunday, February 6th, 2022. And we start.
I mean, they might have the Pro Bowl on, but if you want to watch the Pro Bowl, I mean, that's up to you. That's
well, they can record the Pro Bowl.
Yeah, there you go.
And I'm trying to remember the timing, but just go to the website. The link is going to be below.
Noon to 6.
Noon to 6. Okay, yes,
Right.
That's right. Yeah, noon to 6. I for
noon
some
to
reason
6 Eastern.
Eastern time.
Eastern.
That's right. Eastern time. And so noon to 6 Eastern time. And so I hope that you will join us. Make the decision today, because that's the tool of the devil. Tomorrow is the tool of the devil. There's no sense in waiting for tomorrow, doing tomorrow what you can do today, especially if it has to do with your health. Because as we know, a healthy person has 1,000 dreams, but a sick one has only one. And let's make sure that we do everything we possibly can to not only get all the stuff that's in Dr. Levy's head and all his books, and we condense it so that we can make it our own roadmap to health. So thank you once again, Dr. Levy. Thank you all for watching, and I look forward to seeing you guys tomorrow. We'll see you soon.
Thank you, Lily. Take care.
No, thank you.